Okay, good afternoon, everybody. Thank you so much for moderator introducing me. So today I will talk about uncovering ocular parasitoses infection in Myanmar. Okay, let's start my presentation. So before the going to, okay. Firstly, I would like to talk about the classification of the parasites of endemic, important, and disease. They already classified into the three parts. One is the protozoa, second is the helminths, and another is the arthropods. For the helminth infection, they also the nematodes, septodes, and trematodes. So I think all of you already noticed about this. And ocular parasitic infection the consider is a significant causes of ocular pathology worldwide, and ocular parasitic infection had been widely reported from the different geographical areas, mainly depending on the epidemicity of the parasites. And the prevalence depends primarily on the geographical distribution of the parasites, socioeconomic environments, and immune status of the patient. And the common mode of infection, all you already know about. Firstly, direct contact with the parasite, for example, leishmania, acanthamoeba, and second is the through bloodstream, for example, toxoplasma or malaria, and another one, the third is the congenital transmissions, example, toxoplasmosis, and fourth is the zoonotic transmission, primary infectious disease of the animal, and then that's naturally transmitted to the humans. And additionally, few of the helminths that may lead to ocular infection are transmitted by the betta, like the torofolariasis or thalassiosis. And finally, consumption of the contaminated foods, sparganosis, or like indirectly from the environment, fasciolosis. So this is just like is the show about the based on the anatomical view of the eyes. We can notice about the based on the anatomical view. We can know about the what parasite infection is mainly focused, and the pathology of the eye can occur due to the direct damage by infection pathogen or indirectly by the toxic process, immune-mediated or apoptotic localization by ectoparasites. The clinical diagnosis usually mimics other pathology due to numerous etiological both infectious and non-infectious. So therefore, at the high intent of clinicians, especially in require for infectious parasites etiology in patients having inflammation in the eye. In addition, eye can be involved in various systemic disorders and thorough ocular examination, along with the history of travel to the endemic area, risk factors, and other associated medical illness that can help to the, establishing the preliminary diagnosis. And so today I mostly focus on the helminth infection in Myanmar. So that's why among the helminth, ocular infection are caused primarily by nematode parasites, Onchocera, volvulus, lola, Onchocera. And another one is the case study of the ocular infection by other nematodes like the Angiostrongylus, cantonensis, Dolpharias, Ripen, Thalassella, Septo, and Trematodes, etc. This figure shows the warm geographical area endemic for the ocular nematode and septal infection. Before going the presentation, I would like to introduce about the country profile. All you already know about Myanmar. Myanmar is one of the South Asian country, and even also it is the developing country and tropical countries. Today, I will talk about total 42 cases of ocular parasitol infestation in Myanmar up to 2020. However, we present only ocular helminth infestation and no recorded cases or other reported cases or other infection. This slide is the ocular nitrosomoyasis cases. Myanmar is very common about the recent year. Ocular nitrosomoyasis is very common and already recorded the world highest cases in the world. And maybe due to the geographic or maybe the habits, eating habit is changing habit. So commonly found in the eye infection. Also that we already published 2 papers about the human nitrosomoyasis case in Myanmar, and the last year we also recorded 2 ocular nitrosomoyasis in Myanmar. So maybe nowadays total more than 20 recorded, and last year we found one case of ocular nitrosomoyasis, but we cannot do any other confirmation or diagnosis test or molecular technique. We just only the healthy record. So this is the cumulative distribution of ocular nitrosomoyasis in the world. So Myanmar is the highest in recent, around at least 20 cases in the world to compare with other countries. And for the neurostroma, we are also the epidemiological study, also the very few limitation. So in Myanmar, neurostroma spider found in freshwater fish, such as the east, snakehead fish, and catfish. And even also last year, the Professor Chai, he report about the neurostroma spider also found in Chinese edited frog or hoopload, Batrachus regulosus. And also that for other Judinian neurostomosis also recorded more than 40, and still remain under reported cases in Myanmar because we can some other how to say Judinian migrant cases we cannot do any how the serology or molecular confirmation test. That's I think last year we start to try to find about Judinian neurostomosis cases using the rapid diagnosis test. At the time, we found around 5 cases had serological positive, but now probably yes. So that's why today I didn't mention about too much about this case. So another one is the ocular fluorescence caused by the Lola Lola. So all you already know about the Lola Lola microfilariae are transmitted by dead biting hawk flies. Ocular manifestation may occur due to presence of both microfilariae and adult one. The adult one may survive up to 15 years and had been found in the conjunctiva, the trias, iris, and anterior chambers. This is the second common cause in Myanmar. And adults found all Lola are the wound commonly found in anterior chamber of the eye at the previous repose. And all cases were confirmed by microscopic examination but cannot perform antibody test or molecular examination till now. Maybe Aurora case is at least more than 5 recorded cases in Myanmar still remain the underreported cases till now. And the third is common case is the cysticercosis. Cysticercosis is caused by the larvae of the Taiwan Tinea solii. All cases were reported within 2000 to 2010. After that, no cases reported about the cysticercosis in Myanmar. Unfortunately, in 2017, figure examination in Yangon, Myanmar revealed at all the Tinea species in 2 children from monastic school. And another recorded case in 2018, one cysticercosis suspected case by computerized tomography scan, CT scan, presented with the ophthalmological problem. But we didn't perform any confirmation test, and we just only treat with the antiparasitic drug, and then patient recover. So we cannot say this is maybe due to cysticercosis or not. Just only how to say radiological test. And this is the cysticercosis in Myanmar. And so for the cysticercosis, for other cases, a man total 2018 apostate through sample from total of 4,800 microscopic through examination performed 5 years between 2012 to 2016 in upper part of the Myanmar. So this is a little bit high. Another is the local paper, among 38 paper to examine the cysticercosis. Only 5 studies reported lineages with 0.1 to less than 154% to positive rate. In 2018, they also performed the zero prevalence of tinea solium IgG antibody using ELISA test was 4.7%, and for the stool examination, only 1 patient in study population. So in 2018, also we found one case of the tinea saginata type 1. They found the supraepiglotis spread after medication with parasite treatment. For the Thalassia calibrator, so this is the recently we recorded. The thalassasia is caused by nematode Thalassia calibrator transmitted to human by the Drosophilus flies. It is also known as the Oriental eyeworm due to its geographical distribution in Asia Pacific region, China, India, Thailand, Indonesia, Japan, and Korea, also the Russia. These parasites mainly cause infection of the anterior segment of the eye, but intraocular infection involving vitreous and retina had also been reported. It is at the associated with poor personal hygiene. So in the recent year, ocular thalassaiosis cases also gradually reported, and all cases only found in southern part of the Myanmar. Another one case report is that in 2019, this is the Angiostrongylus cantonensis. So Angiostrongylus cantonensis cases caused by the Angiostrongylus cantonensis infection. It is a foot-borne parasitic disease. It's primarily characterized by eosinophilic meningitis, meningio, encephalitis, or myelitis. So in this case, 63-year-old woman came with a blood vision, congestion, and epiphora, and he had a history of eating vegetable more prefer. So when after day 3, the eye surgeon found a wound in the eye. So and then they made the surgical removal, and then morphological examination done by the National Health Laboratory. They said this is the Angiostrongylus cantonensis. So that's why we recorded one case in 2019. For this case, this is the Onchocera volvulus suspected case. Why we talk about Onchocera volvulus suspected case? For the histological examination, the pathologist suggests this is the Onchocera volvulus, but Onchocera is also known as the river blindness, and it's caused by Onchocera volvulus. It is the Filarial nematodes. This is the common in Africa. So our case is the 60-year-old woman from the Molamya, southern part of the Myanmar, presenting with the orbited granulomated swelling at the mediate portion of our fronted bone near the orbital margin. And then she didn't have no travel history. So based on her condition and geographical condition, we suspect this case is the ocular dorophlariasis. It's caused by the Dorofilaria river because the Dorofilaria is very common in the South Asia country. So that's why maybe this wound is due to Dorofilaria river. So I write this maybe Onchocera volvulus suspected case because we cannot confirm any confirmation that. And another one is the myiasis due to the ovis. This is only one case. Myiasis is an infection caused by the larvae of fly. It is common in tropical and subtropical areas. Myiasis in other parts of the body are very common in Myanmar due to the socio-economic condition, personal hygiene, and tropical country. However, ophthalmological infestation is very rare and only one case reported. But maybe it is the underreported cases due to the eye infestation by larva fly. All cases are the lower part of the Myanmar, so we don't know about the upper part of the Myanmar condition. Till now, no, there is very no case reported about the parasitic infection in Myanmar, upper part of the Myanmar. And identifying cases, it is very high. At least total 10 recorded cases are annual parasitical infestation. Belong to the ophthalmologist's opinion, more of the correct parasite are Netrosoma species and low-level infestation, but they did not further confirmation test. So that's why we put this as the unknown cases. In 2018, also one and identified cases was nematode infestation at the anterior chamber, and then the eye surgeon choose the focal laser therapy. So that's why no morphological examination was done. So I put this case also the unidentified parasitic infection. So this is the all cases of parasitic infection in eye in Myanmar. So Netrostoma is the very stay high, around more than 20 cases, and annual is the around 10 cases. After that, Lola, and the Thalasia capillata. So in here, we present underreported cases or hidden cases of ocular parasitical infestation in Myanmar. High index of clinical suspicion is required to establish the diagnosis for further confirmation by laboratory techniques, followed by specific treatment. The further research priority need to be directed to study about the epidemiological survey, rapid diagnosis test, and confirmation test. Moreover, public awareness and health education for parasitic infection and improvement of socio-economic status. Personal sanitation are still needed in Myanmar. And in summary, Myanmar is a high prevalent country of ocular parasitic infection, but still challenging on diagnosis, investigation, and epidemiological survey on both human and animals. I hope in the future we can perform the serology or molecular confirmation test prerequisites for not only ocular infestation, but also other systemic infection. Because till now we cannot perform any serological test or any molecular confirmation test for all parasitic infection in most of the parasitic infection in Myanmar. We just only perform morphological confirmation. So this is the state challenge for the Myanmar. And another one is the clinician also they suspect parasitic infection. They cannot perform other confirmation that they just only treat the patient with anti-parasitic drug. So this is the difficult to record about the parasitic infection. And another one is in the record all recorded cases, for the comorbidity is stay challenge or parasitic infection after removed parasite, but the eye problem is still remaining. So that's why public awareness also very important to prevent about the parasitic infection. Okay, thank you very much for your attention.
Thank you very much for the informative talk from Mr. Y. And now it's time for Q&A session. Any question from Zoom or the question in the chat box also welcome. Another one question from the chat box. From your presentation, there are unknown worms in the data. Is the parasitological or the treatment different from the identified worms?
Yes. Yes, but in our case set, mostly we choose the surgical removal or the one, and then because sometimes the how to say the transportation in the hospital we cannot found the how to say the diagnosis of the this confirmation test, so we send to the national health laboratory. And so this during for the transportation a little bit difficult, and sometimes the patient didn't want to confirm, and so in this situation just only remove that parasite and then treat with anti helminthes like that. Mostly common we use the ependazole or mebendazole.
Thank you. Another one question. Thank you for your interesting and informative presentation. I would like to ask you regarding your report. My question is, which province or regions of Myanmar has a high prevalence of the nattosomiasis parasites because the number of the infection is so high in the country?
Yes. Based on my recorded cases, mostly are the lower part of the Myanmar. Yes, upper part of the Myanmar is very rare to report about this. Mostly the lower region like the Yangon or Molamyai, like this. The mountain region are stay very high on other Cyticercosis, because when I work in the hospital in mountain region, I always found about the Cyticercosis in the state, but very rare about the nattostroma. But in the how to say lower part of the Myanmar, very high about the nattostomiasis, and even also the how to say we examine in the eat fit Asian swan E in the Yangon region, very high about the nattostroma larva. Maybe the 1E we found in the liver, 1E, maybe more than 60 E we can find in 1E about, but we cannot examine in the muscle or the E. Also intermediate host also very high nattostroma larva.
And one question from the chat box, how about the treatment of this eye parasite infection? As we know, dyed parasite may cause severe inflammation.
Yes, and very severe inflammation. And even also the after even also remove that one, the patient had the eye problems they happen because last in 2018, one recorded case, we removed the one recorded nattostomiasis case. We removed the nattostroma by surgical removal. After that, we follow up the patient. She is from the southern part of the Myanmar. Yeah. So we follow up, but stay now. After I follow up, she had the problem of the eye problem. Stay had how to say comorbidity. So cannot full recover. Yes. About the even also the removal of the parasite.
And one question from the chat box for the identified specimen, is there any referral lab or institution?
any molecular level. So very stage challenging about the molecular confirmation test. So that's why I already mentioned we cannot perform because how to say limited. So and even also the how to say for the molecular we need with some laboratory they don't have that many no grant about that this screening, and even also that if patient want to perform but patient some of the patient cannot afford to confirm. So that's why it we know okay this is the similar with this parasite, just this okay, and then treatment like this, just all we do. So that's why in the future I would like to perform rapid diagnosis test or any other molecular confirmation test to know that specific cause organism.
And one question in the chat box. Were thus parasites causing ocular infection identified at the molecular levels to confirm the causative species?
Excuse me. I think this is already answered.
Yes.
But the one that I'm asking for the unidentified specimens, is there any referral laboratory or institution you send the specimens? If you are not able to do it by yourself.
Yes, the one thing is the how to say based on the collaboration. Sometimes how to say we are the different hospital and university is a different township. So at the time that some eye surgeon didn't want to send specimen to the university or laboratory, so they just only how to say remove and record. And sometimes even also that sometimes some causal organism cannot confirm by the morphology. So in this situation, even also the microbiologists, they just record at the unknown parasite. Sometimes that when we remove remove the parasite from the eye, the parasite is the how they already damaged, morphologically damaged. So that's why we cannot examine. This is the what parasite. So the main problem is that we cannot perform the molecular or any serological test. So that's why for based on the morphological examination, we should get in-depth how to say endemic parasite. But for the surgery remove, sometimes the how to say very the wound is very attached to the tissue or organ. So at the time we remove it tight. So the parasite is how to say broken. So in this situation, we cannot say this is the how to say is that causal organism. So we record this at the time. We record as unknown parasite like this.
Okay, thank you. Can I ask one more?
Yes. Yeah. Okay.
Yeah. Khon has developed several diagnostic kits. Maybe there are some to solve your problem.
I hope. Yes. Last 2 years, we used how to say rapid diagnosis test on natostrobiasis for the cutaneous infection. Unfortunately, maybe some are the positive, but today mostly I talk about the ocular, so that's why I didn't mention about the cutaneous cases. Some of yes, we already recorded at least 5 or more recorded case of the cutaneous natostrobiasis using the rapid diagnosis test kit, but still challenge because how to say we had only 10 or 7, only 10 or 20 test kits. So we need more.
Okay, yeah. Too few, yeah.
Yeah, very few. Yeah. For another one is that just only nattostomiasis test kits. For the other parasite, we don't have. So yeah, so that's why the state have problem to confirm by using the rapid test kit or molecular.
Okay.